Hello, everyone. We are very happy to have you here with us. I hope you can see my screen. Yes, I cannot see you when I'm presenting. Okay, thank you, Angelina. This is Eva Salmatani from the Hellenic Digital Health Cluster. We would like to welcome you in today's workshop about health data sharing, building trust, innovation, and growth. So we wanted to do this workshop because we would like to hear from you. We would like to hear from the stakeholders about health data. And in our effort to gather the ecosystem together, we contacted specific people that we would like to hear your input. So before we start, I would like you just to say hello about just a quick hello from which organization you are, so that we have an overview of the people that we are here. Who would like to start? Maybe Angelina would like to say hi.
Yes, hello everyone. I'm co-hosting this workshop today. My name is Angelina Korubali and I'm here with a capacity of research coordinator of the Hellenic Digital Health Cluster. Welcome to the meeting.
Mr. Berler, maybe?
Hi, I'm Alexander Berler. I will try to present during this webinar a little about what's in the case. I'm happy to contribute in the discussion afterwards.
Alexander, your sound is not coming through very well. I don't know. Maybe it was just temporary.
I hope so too. I mean, I cannot manage telecommunications.
Yeah. Okay.
So, okay, I'll see what I can do. Was it better now? It was the same.
No, it's better now.
Okay, fingers crossed. I probably will hide my camera if we see that's not it's a big problem.
Okay, thank you. Thomas Halatsis and George Gogolos, maybe you would like to say hi from...
Yes. Thank you, Eva. Thank you, Angelina. Thank you, Dimitris. Thank you, George, for this initiative for the workshop. Me and Thomas, we represent the JOIST Innovation Park and the Institute of Entrepreneurship Development. We collaborate in this project, and it's an honor to be here with you today. And we are eager to hear interesting things from you.
Hi everyone also from me.
Hi, Thomas. And now I wouldn't like to say names. I just said those that I know personally. Whoever wants to say their organization, feel free to do so. Dimitri, maybe. I forgot. Yes. And Georgios Manias, please. Hi.
Yes, hi everyone. Hello. Thank you very much for the implementation of this initiative and, of course, sharing the invitation to me and the ComfortAge project. I am a research associate in the University of Piraeus Research Center, and I have also the privilege to be the coordinator of the ComfortAge project, which is a EU-funded project under the Silver Deal of the European Commission, Horizon Europe Research and Innovation Project. And I would like to follow the discussions and hear more from all of you. Thank you very much once again.
Dimitri, would you like to say?
Thank you all. Thank you, Eva and Angelina and Alexander, for giving us the opportunity to have this workshop today. For the purposes of this workshop, I will represent FORTH, which is the largest research center of Greece. So I will try to convey the perspective of an academic research institution into the discussion.
Thank you, Dimitri. And other people, if you want to say hello, of course you can. Okay, we will record also the meeting and then it will be uploaded on our YouTube channel if you want to see it. We will continue the discussion as we continue. So I will start with a presentation. Okay, you can see it. So the agenda for today is a short introduction from me about HDHC, what we do, and the VELES project in the context of which we are doing this workshop. Then we will continue with Mr. Alexander Berler, who is Strategic Business Development Director at IHE and Director of Gnomon Informatics and Vice Chair at HL7 Hellas. Mr. Berler will talk about the HDS, the current developments in Greece and in EU. And then we will continue with you with an interactive workshop through Slido about health data sharing. We want to see your point of view based on a previous research that we had done during VELES project and the upcoming efforts that we are happening in this project. And Dr. Angelina Kouroubali will coordinate this workshop, through Slido. She's research coordinator of HDHC and collaborating researcher at 4th Institute of Computer Science. So our goal through this workshop is to see where we are with the EHDS, where are our countries, especially Greece, and we want to gather your insights on the challenges and the policy needs. We will discuss specifically about trust and collaboration around health data sharing, how VELES and similar initiatives can support the alignment of the countries with the HDS, and we want to inform actions towards the sustainable data ecosystems, which are aligned with the EHDS. This is our goal. I hope we will manage to do that and exchange feedback between us and discuss. Who we are, the Hellenic Digital Health Cluster, it's a cluster organization based in Greece with focus on digital health. We want to strengthen the Greek ecosystem and to put Greece around the leading countries in the field. It was established in 2021, so we are a kind of new organization as an initiative of FORTH, the Foundation of Research and Technology, which is one of the biggest organizations in Greece around research. And recently we received the Silver Cluster Management with Excellence. It's a certification that the clusters receive if they have some milestones, and we are very happy about that. It shows our progress and our efforts in the ecosystem. Now we have 41 members coming from Greece and working around digital health. And our aim in this cluster, how we work, is to develop the synergies, to develop cooperation between the different actors, to network the key stakeholders. That's why we do similar workshops and webinars. We participate in different events. You might have seen us in similar events around digital health. And our efforts is to support companies to attract funding, to promote collaboration with national and international clusters and organizations. That's why we are active member of different EU networks. And we hope that we will support the development of a national digital health strategy. This is our goals, and one of the activities to achieve these goals is also the participation, implementation, and development of research projects. One of that is the Level Up project, which is about training courses in digital skills. This project is about to end. You can find the information on our HDHC website about our activities and the projects that we are in. So this is Level Up. Then we participate in EHDS project, which focuses on remote patient monitoring and how we can scale remote care technologies in the ecosystem of Europe. Here we are very happy because we participate with different cluster members and companies, and we are very happy about this opportunity that we have to collaborate. And then we go to VELES project, under which we do this workshop. This is funded by the Horizon Wideera program. We are in the middle of the project. So we have started working, and we see the difficulties that exist in the countries that we participate. We are 15 consortium partners from widening countries. We combine Greece, Cyprus, Romania, and Bulgaria as the widening countries. And then we have more advanced partners, more advanced countries from Spain, Germany, and Sweden. Our goal, the vision of VELES, is to accelerate the innovation excellence in smart healthcare by combining and seeing the differences between these different countries. And we want to create a sustainable place-based innovation ecosystem through the regional smart health data space, which pioneers the EHDS. This is our goal. We hope that we will achieve it. The ecosystem that we are building on is following the quadruple helix. So we have stakeholders from all the sectors: business, investors, citizens, patients, public authorities, academia, and research centers. And that's how we tried to contact in this workshop different stakeholders from all these sectors. And through the regional smart health data space that we will develop, we will also develop some use cases in different topics in the 4 countries. In Greece, we will do about cancer, in Bulgaria about Alzheimer, in Romania about cerebral tumors, and in Cyprus about dementia. All the information about the project activities, you will find them on the VELES website. I will put it on the chat afterwards. And this is it about VELES. I hope that if you have any questions, feel free to do so, and as we continue the discussion. And I will give the floor to Mr. Berler to continue with the current developments about the HDS.
So thank you very much. Let me try to share my screen. And I think you should be able to see my screen now, right?
Yes, and full screen.
Maybe now it's full screen.
Yes, now it is. Thank you.
Okay, so I'll try, I hope in about 20 minutes, I think I have to try to explain a little bit what's happening with the European Health Data Space regulation, try to propose some ideas for what we could do in Greece, as long as, because as you know, the regulation has about a 6-year implementation plan. So it's not something that will be active tomorrow, but a lot of preparation needs to be done. So as we all know, the basis of all this, after several discussions, the regulation was finally voted and signed on the 11th of February of 2025. And the concept was, the Commission has a way try to create and implement a common strategy for digital services around Europe and create what they call the digital single market. And in that approach, one of the ideas was to create digital data spaces for different domains. So that's something that was conceived at the last minute because it's in the planning of the European Commission for a long period of time. And what happened in practice is that this was somehow streamlined and put as a priority after the COVID pandemic in 2020, 2021. So suddenly the health data space became a priority, and they started discussing between member states how this could be regulated. And the first legislative proposal was out in May 2022, and it took about 3 years to get to the regulation. So the regulation has a lot of things inside, and we will speak more in detail about the different basic components. But I think the main scope that is to be able to expand the health data exchange in Europe between member states, trying to expand the existing services for cross-border to something wider. Also try to support the basic concept of the data spaces to try to support the digital single markets and try to create a single market for vendors around Europe, because the problem that we have is that it's very difficult for a vendor that is, for example, located and operates in Greece to sell software services outside Greece or in another European country. There are regulation issues, etc., etc. So the idea of the regulation is to try to break that barrier. And the other point is that they want to make a bridge between creation of quality data that can be exchanged, but also being used for secondary use of data, try to solve issues that arise during the COVID crisis, for example. And in parallel with all this, there is, of course, the AI cycle with the other AI Act and the regulation, and there is a lot of commonality between the two. So as we can see, the text is online. You can read it in detail. It's split into 5 chapters with a lot of restart at the beginning and some annexes at the end. And it's already effective since March 2025. So that's the difference. It's not a recommendation, it's not a guideline, it's a regulation, which means that it's immediately effective and member states need to act immediately upon it. As said before, the Commission is trying to set up this 2030 digital decade approach since a long period of time. And you see that in Europe, there is a huge amount of regulations and guidelines and things that any vendor or company needs to somehow take into account when they are implementing or creating a software as a service. So the data space regulation is not the only one. So just be aware that this is not the only problem that we face, and we need to probably discuss about all the other so that we can create comprehensive solutions. Now, so going back to the regulation itself, as said, it has 3 main points. The first is that it wants to increase the possibility of the correct standard-based use of exchange of information on the primary use of data, so for treatment, for the treatment cycle. And there are 2 main topics. The first topic is to try to create services based on the patient access to their data, so patient-driven or patient-mediated use cases, but also expanding and making cross-border implementations mandatory, which means that now we have 15 countries that have implemented some of the services, not all of them, which means that until we get to the magic number 29, because so there are also Iceland and Norway in the cycle, and we still have a lot of countries to comply. The second is the use of secondary data for research purpose, and I will not focus on that one. That's by itself a topic of maybe another webinar in the future. I will mostly focus on the first one. And also on the third part, which is the basic requirements for electronic healthcare ecosystems that vendors will need to prove their compliance to 2 things in the regulation, the interoperability component and the logging component, and that we will talk about that afterwards. So The important thing is in the primary use, as said, there are two things that they want to implement. One is give more values to the patient rights. So if you read the GDPR regulation about data protection, it puts a lot of locking points. So trying to protect patient data, sensitive patient data, and the regulation is trying to open those locks so that we try to reuse those information based on consent and other things, so that patient can create and have more solutions for themselves. And the other is to try to expand EU health information exchange highways, like the My Health at EU service for cross-border, but also probably other architectures like the EUD, the wallet architecture, which is more citizen-oriented as a way of exchanging data. On the EHR systems, the idea is to try to map and create regulation, and there will be implementation act about that, but member states will need to comply on trying to create EHR systems or systems that exchange data. So what is an EHR system is not yet fully defined. It will be defined in the next 2 years, but let's consider that any system that is storing healthcare data is mostly considered an EHR system in Europe. And there will be specifications and testing tools for the interoperability and the logging component that will be tested and created along the way until theoretically March 2027. So on the secondary use, the idea was to create an ethical approach and creating those health data bodies, so a single point of contact in each member state on how to exchange and structure data, mostly in an anonymous or de-identified way, so that those data can be used for research, for new medication, product creation, etc., etc. So those are, it's mostly chapter 4 in the regulation, but I guess we can say more of that in the future. Now, another important thing, which is mostly chapter 1, is the different new rights of natural persons in the primary use of data. So you see a lot of additional services that are going to be created, and the structure is most, since the medical in the professional clinicians, they work by either creating clinical documents or reading clinical documents. So that's the right way of working. And I said there are two ways of doing that. One is doing the patient-mediated use cases through patient portals or similar things, or mobile applications, or through using the more robust information highways and the interoperability architectures. Now, I have some slides about the different patient rights that are somehow put in the regulation. I won't get in the details of all, but the most important one is the patient access. And a lot of projects now are working in that domain, in the, let's say, innovation or research domain, about how can we deliver patient access to citizens. A good example of such projects are, for example, the ICShare that has created the yellow button approach, but there are many others as well. Also, the basic concept of the data portability, that the patient should be able to get his information from an EHR system and then either send it to another or find ways to being the conveyor or the owner of his data. And as well, there are two models here that are under discussion, the pull and the push model, but I won't get in the details now. Also, related to the logging component, this is an important thing that is not only interoperability issues, but how do we know as citizens and patients who has access to our information and for what reason? So that's the concept of the logging component. And that means that a lot of new IT systems and software will need to be created or integrated in existing systems. So there is always this classical article related also to GDPR about being able to restrict access. And there was a lot of discussions during the creation of the regulation, which was the right consent model. And at the end of the day, the recommendation of the regulation is to go for the opt-out model, which means that all member states will implement ways and unified approaches on dealing with that access. But patients will need to have the possibility to enter somewhere and say, I don't agree with that. I would like to restrict access for some reasons, either to specific people or for a specific period of time and things like that. So that's more or less as a follow-up of the previous slide, talking about this opt-out approach, which simplifies a lot the legal part, because you create one infrastructure and then citizens have the right to say no for whatever reasons they might have. Another important, which is very good because a lot of research projects are working in the domain of working with patient-driven data or prevention models or disease management treatments, which means that there are a lot of data now coming from the patient himself. So the regulation now will also try to give solutions to that, how we can include patient-driven data in the EHR systems. Other problems that are going to be dealt by regulation is the concept of proxy. I mean, in healthcare, there is always a relative or a trusted medical professional to which we grant access to our clinical records so that we ensure that the treatment is adequate. So that's also part of the specifications that now are being discussed and conceived, how we can map this, because for the moment, the only way to deal with this proxy mechanism is by legal means, meaning using notaries and very complex and expensive legal models. And the last one, I think, is the request for rectification. So sometimes you see information in your EHR record that are not completely correct. And at least personally, I have seen things like that in my My Health app in the Greek context. So it seems that I have disease that I don't have, but I guess you might have the same feeling as well. So those things in the future, you should be able to rectify things like that. So this is mostly some suggestion in several articles grouped here on how the accessors will work. So as I already mentioned, patient-facing views, so patient-mediated use case, and health professional-facing, so medical professionals speaking to each other with the consent of the patient through EHR to EHR connectivity. As said, one important thing is that the cross-border services will need to become mandatory, and that's the point mentioned in Article 23, if I remember correctly. And this architecture used for MyHealth.eu will be enforced to all member states with the central services and all the connectivity with the MyHealth.The OpenMCP approach and all these things that will become mainstream, and all the documents of the exchange format will be exchanged at least through that network. Now, the important also thing is the exchange format, which is Article 15, which tries to create a set of data that will be common to all member states. And also all EHR systems in Europe will have to be able to input or export data based on that format. This is grouped into two groups. One is patient summaries, prescription and dispensations. And the second group is more complicated, medical images, the studies and the images. And the medical test results, the laboratory tests and the reports, and the discharge reports. So all this is their projects that are currently working on how to do that. And more or less, there are three things that will be somehow documented in the specifications. So the harmonized data sets and the logical models behind all this. This is almost done. The different coding systems and values that will be needed. So this is mostly seen for the moment as an extension of the cross-border master value catalogs, but this remains to be proven in practice. And of course, the technical specifications, how we should create transactions to be able to exchange this in a stable way. So you can see this a little bit represented here. This is a slide from XDHR, which is the joint action project that is building those logical models and those specifications at the moment. So also this project XDHR is going to create common specifications for basic general requirements related to the electronic healthcare records. And you see some of those topics being discussed there. I think the important thing is the metadata layer that is being now discussed, because we're talking about creating clinical documents, and those have also always a metadata layer included in those. And some of those documents from XDHR have already been released for public comments. You might have seen some of those. If not, you can ask me. I can try to give access to some of them at least. So in that discussion, the important thing is what is an EHR system and what is not. So this is more or less the current approach of the initial discussions. So in practice, anything that is somehow creating, storing information, export, imports, making mappings, conversions, anything related to sensitive data that are included in the EHR system will be considered as EHR systems and will need to go through the official validation process. So they have also already started thinking how those EHR systems should be somehow mapped at the different stages, cross-border, regional, national, local. And at the end of the day, you see that EHR systems and APIs and interoperability are a bit everywhere. So the way that the regulation is structured, it's somehow influenced the whole ecosystem. Now, we spoke about this third pillar about the harmonization and the regulation that's within a scope of at least 2031. All EHR systems needs to be somehow tested and harmonized for those two components, the interoperability component, which mostly is the exchange format, Article 15, and the logging component, which refers to the access of patients to their logs, which is Article 9. So this will be fully documented in the Implementation Act that will be released the latest March, end of March 2027. So we will know exactly how this is going to work by then, but a lot of things are currently being in the makings, and all stakeholders are invited to contribute. So all of us, we can influence if we want to do that. So how this compliance is going to work? The first step is it's a concept of self-declaration of conformity. So the idea is to try to make it as simple as possible, to create some testing tools that can be reused, and those testing tools to be integrated in the testing platform of the member states. Because by only certifying that the software can import, export a document from the exchange format is not enough to ensure that those documents are used in real life use cases, which means that in theory, this digital testing environment, DTE as they call it, will be included in more thorough testing environments and certification processes that each member states have. At least there are several member states that are very thorough on that, like Ireland, France, Austria, etc. Unfortunately, we don't have those processes in Greece, and we should, as a community, try to ask the policies to create them. It's a unique opportunity to do that in Greece. So you can see a little bit how this is, at least this is the initial view of the Commission, the different steps. They are not yet documented, but you see how they are trying to map the different references about conformity in the regulation in active things. So there will be two software components developed by the Commission. One is the DTE, and the second is the database system. At the end, the last step is that someone needs to upload some proof of compliance in a database, and this database is going to be used by the market surveillance authorities that the regulation is depicting in other articles, and will enforce at the national level that whatever is being said is close to reality. So there might be penalties involved if the regulation is not correct or things happen at the national level, but this is not yet clearly defined. So this is the overall scope of the regulation. as you see, we are now in the period of creating the implementation acts and preparing the specifications and doing a lot of testing events to try to validate the quality of the specification. So we need to contribute and participate in those events. But more or less at the end of the day, all the important things for the HR vendors will happen between 2029 and 2031. So those are the two critical years for the conformity. Today, but as things move very fast, 2029 is not that far away. Practice. Here is just a slide to see all the different activities, related projects that are happening, trying to validate this regulation. And today has a budget of about 830 million in the upcoming years to try to happen. So there will be a lot of financial support, I guess, to all of us somehow to make that happen. Here you can see all the references. You want to read more about those things. So the lines, I didn't check last if all the links work, but 3 months ago they were pretty okay. They're still there. Now, what can we do in Greece? I think we need to reuse like the cluster. Here we are that is hosting us. Try to use all the opportunities to start preparing from now. Contribute, try to co-create real-life use cases, influence, and be present as much as we can. Also contribute in early stage, let's say, exercises that are being done, like hackathons and plug-a-thons. IHE, for example, is doing plug-a-thons since last year. There was a series in Vienna, and the Connectathon week there, and there will be new ones in the next event in March in 2026 in Brussels. So contributing there or even participating to the IHE Connectathon floor, because there will be a pool of compliant IHE profiles for the regulations. Some of them have already been documented in the XDHR deliverables already. So being part of that community for sure will help a lot preparing for what's coming up. Also, in the Greek context, we will have the Athens Digital Health Week, most probably between February 16th and March 20th. So we still are in discussions with the organizers, meaning Ivika and all those people, to see which is the best date for them. But keep in your calendars that most probably in mid-February, we can try to even do a similar testing event in the Greek context. To use it to educate also the Greek vendors and the Greek ecosystems. So I think the role of the cluster there will be of great importance. Now, two things that we don't have in Greece. We don't have a national strategy about e-health. We have been saying this as HL7 Greece, and Dimitris Katifakis can confirm that we have been trying a lot to impose rules and strategies, and also trying to enforce the interoperability firm in Greece. So, I mean, the legal framework is also not there. Closing. This is the venue for the Connectathon week in Brussels. There was already a pre-registration process that ended last week. And the research will be open until, I would say, end of November, mid-December. So try to be there. It's a very nice place and a very nice venue. And if you want to participate in the European data space related events there, this is what you will we will work on as a community to try to test. There are already some type of specifications that we can use, and we hope to do a testing event. It's not yet fully confirmed, but 90% of chances you will be able to come and test your products against what is already there of European data space specifications. Thank you very much.
Thank you very much, Mr. Berler. It was very comprehensive, the presentation that you did, very helpful. I hope that people have questions. I'm not sure about the time, if we will have the necessary time to respond to all the questions. I have one just personal question, let's say, for you. What is your opinion, like your view, how optimistic or not you are about the regulation and about Greece, the process that we need to follow? What is your view?
I am partially optimistic, to be honest. So one thing is that, at least in Greece, we have been spending around 300 million euros to upscale the strategy of systems, and the regulation of future alignment with international standards is not there. So they will have to do it as a second stage. Now, if they have already planned it, they have allocated money for this, and what is the plan, it's not known. I don't think even for the moment they are probably not even talking about that. They see it as a future problem. But I think what we need to do as an ecosystem is we need to tell them that, I mean, products and systems, they are not created out of the blue like this. We cannot conform to whatever they want in 1 week. Then we need time to align. So that means that they need also to start doing processes. It might be a dedication at the beginning or things like that, so that and this is potentially the role where as a community we can be supportive. The cluster or HDHC and VELES or other organizations of that sort to try to help, and maybe this is where the Athens Week can be a milestone for us to raise our voices. Next year might even be an election year in Greece, so why not? So that we increase a little bit the chance that this will go, because as I said, the Commission will create the testing tools, and all of us with our systems will go and upload the files and get that certification and get the CE mark and all this. So that's okay. That's not going to be very complex. It's a self-declaration. So I think that will happen. But will that allow us to sell products outside Greece, which is the scope of the regulation? I don't know. If this is not inserted in the real operation of the healthcare systems, I mean, doctors don't create or read documents based on the exchange format, it would not. It would just going to be another regulatory check in the list of regulatory checks that we need to do. So more time to spend, more money to spend, and no real market result. So that's why I'm saying I'm partially optimistic about that.
Okay. Thank you very much. I don't know if Angelina or other people would like to jump in for a question.
Yes, it's we try to keep the optimism up in the cluster as much as we can, and synergies are very important. So thank you very much for the presentation. There is this whole other topic of discussion at the same time, because this is what is going to happen at the national level. But in the meantime, there are a lot of data sets, health data sets. There is a lot of activity about sharing these data sets. We have large projects like ComfortAge, for example, that is represented today, that is working on collecting data sets, sharing data sets, doing work, secondary use of data with these data sets. And partly the VELES project is looking at what preparedness we need, so that at the meantime we advance research and we advance innovation, because we have a lot of representatives from companies as well as clusters from other countries. So what is your opinion about that? What is the parallel world that is somehow happening, and how we can make this move forward?
So, to my understanding, healthcare is a very complex ecosystem with a lot of stakeholders, a lot of conflict of interest. So not everybody thinks the same way, and not everything is aligned. So we know that. The terminology, the data models, all these are very complex. So in theory, the regulation is here to help to reduce that risk and that complexity. So until we get the legal part, because the Commission will come up with something in March 2027, good or bad, we don't know. One way is that we are as active as possible, try to influence the European Commission. I know that they are really asking for stakeholder engagement and all these things, so they are open up to a limit. But at the end of the day, it's going to be the member states' decisions that will influence what's going to happen. So if we are 27 member states and half of them, they don't really think that European health space is a priority and it's not budgeted somewhere as a next strategy to implement it, then all of us that are creating ideas, research projects, and future products, they won't find a place. So nothing's going to change. That's the big issue. Now, I think what we can contribute in an active way is trying to find use cases that can be applied in real life and see how these specifications or those logical models can be reused in examples, real life examples, so that then we can explain to decision makers that, I mean, it's not that complicated to do, and maybe there can be a roadmap of implementation that it's not, because now their approach is that we're going to deal with patient summaries separately, with lab reports separately, but in real life, this is not how it's happening. You have to do it by domain or disease domain or something, because if you just take cancer, for example, you will need all the documents that are created. So that's why I think designing good use cases and maybe projects like ComfortAge or I2X or XShare, all of those projects around that are running in parallel, I think they need to talk to each other and, if possible, try to make common strategies and reuse common concepts and tools. And that will help a lot. And try to use all our vendor members, or let's say profit organizations in our consortiums to join and actively participate in the preparation of the regulation. So go to the testing events, go to the hackathons, the plagathons, the project of whatever is out there in the next 2 years, because this is the way that you can really influence what's going to happen. If you still and wait like sheep, what's going to happen in March 27, then obviously only the very big vendors will survive. All the smallest ones will have a very hard time to be able to comply with all these things in a short period of time. So that would be my recommendation.
Thank you. Eva?